Welcome back. We're talking with Tori Widowick, who is a physical therapist at Peak Physical Therapy and Sports Rehab. Thanks again for being with us, Tori.
Thank you.
Okay, so now we're going to talk about working with seniors. And as we become older, some of our body functions change and become more limited. Can you tell us how you work with your senior patients on physical therapy and improving their mobility and such?
Yeah, so there's quite a few different things that you can do. Everybody's story is different, what they're coming in with, but if we're going to be general about, elderly population, yes, their reaction time's a little slower, balance. You're working with a lot of fall prevention. You're making them more aware of looking 5 to 10 feet in front of you when you're walking and not looking at your feet. You're making them more aware of the importance of staying physically active in their daily activities as well. So we're challenging with strength and balance and some things that they can do at home as well.
So can you tell us a little bit more about some of the modalities that you use with seniors to keep them more mobile?
Yeah, so like we were talking about before, some manual techniques, some soft tissue techniques, keeping that tissue extensible. When we age, our muscles get a little bit more stiff, or you have arthritic changes that are happening in the joints, so you can do some joint mobilizations. A lot of aquatic therapy is awesome for people that have pain in their knees because of osteoarthritis. Biking is wonderful too, because that takes pressure off of the back and the knees. So there's quite a few different things that you can do to help with mobility.
Okay. Can you tell us about, on average, how long it takes for a senior citizen who's in physical therapy to start seeing some of the benefits of it?
So everybody's story is different.
Okay.
And if we're talking about at a physiological level, 6 to 8 weeks is actually when you start seeing muscle growth. And so telling someone that they may see small improvements over time, but it's not going to happen overnight.
Okay.
And letting them know that as we age, it takes a little bit longer. So those muscle fibers aren't going to be able to grow as quick. So it would take about 6 to 8 weeks for you to start seeing some major changes. And then sometimes it's a little bit longer, 12 to maybe 24 weeks, depending on what you're coming in for.
Okay, so I want to hone in specifically on a condition, stroke. Can you tell us a little bit about what you would do and the process for somebody who has had a stroke and coming in for physical therapy?
So stroke, depending on which area of the body that we're working with. So someone will have maybe the left arm or the right arm affected and they're not able to use it. So something that you can use is called constraint movement therapy. And what this is where they actually take the affected side and they have to use it and they immobilize the unaffected side. And when we're doing this, is the brain, if we're having an injury to the right side of the brain, it's going to affect the left side of the arm, so it's going to cross over. So what we're trying to do is get the brain to not neglect that side and start learning to re-educate it again so that this person can be functional with their daily activities.
Oh, that's awesome.
Yeah.
Okay. There is another condition that we see a lot as we age, and that's incontinence. And we've heard that physical therapy can be helpful for incontinence. Can you tell us a little bit about what that would entail?
Yeah, physical therapy, I don't think we do ourselves justice, but we're movement scientists and muscle scientists about, pelvic floor and those kind of dysfunctions. So what things that we can do is, you can do some pelvic floor strengthening. There's also biofeedback where we use a TENS unit in the pelvic muscles and they have them fire and contract. And we have individuals that have had incontinence for years are able to function throughout their daily activities, which is wonderful.
Amazing.
With that, so.
And then there's another situation as we get older, a lot of times we have memory problems and memory loss. I remembered you talked earlier about physical therapy for that. Can you tell us a little bit more about what that entails?
Yeah, there's extensive research right now showing that if you're staying active in your older ages, that you're able to have better reaction time, better memory, and just better function in general. So it's just that keeping yourself sharp, because the brain likes to always be a student learner for life, pretty much. And so keeping your body active keeps the brain moving as well.
Okay. And then another condition that we see a lot as we get older, a respiratory issue called chronic obstructive pulmonary disease, or COPD. Is there anything that can be done via physical therapy to help those patients?
Definitely. With individuals that have lung disease, you're looking to increase their activity tolerance. You want to get their endurance back up again to move around their house and community. So we have them, work on maybe the bike or just keeping themselves mobile with assisted devices. But we're also working on rib mobility and having deep breathing techniques and helping them with that as well so that they can take care of themselves at home independently.
Okay. And then the last thing I wanted to focus on in this segment is pain. I mean, a lot of us have pain at some point in our life. What are some of the specific modalities that you can use to help alleviate pain, especially for the aging population?
So with pain control, you can use, you could do modalities such as the TENS unit, you can use ice and heat as well, but we use a lot of dry needling that helps improve the muscle extensibility, help decrease the amount of pain in the body. You can do soft tissue techniques and some gentle stretching and just keeping someone mobile with exercise.
And what is dry needling, just for people that don't know what that is? It sounds really painful.
Yes, it does sound pretty painful, but what it is it's an acupuncture needle, but it's not used like an acupuncturist. It's a monofilament, and it's going to go into the muscle tissue that is irritated or needs to be addressed. And what it's going to do is change it at the muscle level and try to loosen up that fibers and send the natural endorphins throughout the body, so our body starts recognizing it and goes, hey, I'm not in pain anymore, and changes that cycle so that people can move better, get off pain medication, and start doing things that they want to do again.
Okay. And in the last 30 seconds I have for this segment, can you tell us how physical therapists work with the patient's physicians to incorporate physical therapy into their care?
We're always working with providers. Even if you come in with a no referral, we always are looking to talk to other individuals about your care, because we need to keep on the same page with providers. So our providers will look at our initial evaluation. We do a progress note and our discharges. They're always reviewing it and signing off. And so we'll ask them for questions, and they ask us as well for advice. And our beauty of being PTs is that we see them more often than a physician. So we're updating them constantly about their care, and so that we're all on the same page and getting them back to their full function.
Perfect. I think that coordination of care is so awesome. So thank you for sharing that. Up next, Toriel will be providing a demonstration on how physical therapy can benefit balance and mobility in seniors. Stay tuned.